chase them away.
Hello and good afternoon. Welcome to today's COVID-19 update with the county's public health experts coming to you from the safety of their private offices. Today, you will hear from the county's Director of Public Health, Dr. Vondo Reynoso, followed by Dr. Henning Ansorg, the county's Public Health Officer. Following their updates, we will open it up to questions from the news media. A note that both Doctors Do Reynoso and Ansorg are due on another state conference call at 5 p.m., so please keep that in mind when asking your questions. As a reminder, this press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Shelley Lawrence. Videos of the press conference will be available shortly after the conclusion of the press conference in English and Spanish on the county's YouTube channel at CSBTV 20. And with that, I will turn it over to County Public Health Director, Dr. Vondo Reynoso.
Thank you, Gina. I'd like to start today with a quick update on the data trends that we are seeing in Santa Barbara County. Santa Barbara County COVID-19 metrics continue to decline, and this is something to celebrate. In our most recent full week of data, so between February 21st through the 27th, our testing positivity has decreased by 22%. Our case rate decreased by 34%, and our active cases decreased by 23%. This is really good news, and if the trends continue, we will be able to continue to reopen in the near future. Next. We have received 105,160 doses. First doses administered stand at 53,106. Second doses administered stand at 32,201. So in total, it is 81% of doses administered. So week after week, we continue to see very high percentage of vaccines being administered in our county. This week's 81% of our allocated doses have been already administered, as I just mentioned. The remaining doses are slated for clinics happening as we speak and in the next few days. Through robust partnerships with various community partners, as well as healthcare providers, we have been able to give over, again, 53,106 first doses and 32,201 second doses. This is a great accomplishment for our county and definitely something to be celebrated. If you have yet to be vaccinated, please know that we are advocating to procure more vaccines and planning for a day in the very near future when you will be vaccinated. Until then, please be patient. Next. We continue to provide vaccines to any Phase 1A healthcare workers who need a first or second dose, but our primary focus has shifted to ensure people in Phase 1B will be vaccinated. The public health vaccination sites are focusing heavily on the work sectors, including agricultural and food service, childcare, and emergency services. Our hospital, pharmacy, and primary care partners continue to serve the 65 plus community members, transitional kindergarten through 12th, and higher education. As you may recall, a few weeks ago, the state announced an age-based system with a focus on those with underlying conditions. And at that time, the effective date was announced to be March 15th. However, there is still yet many unknowns with regards to how this will work. At that time, the anticipated third-party administrator was supposed to have happened, with the expectation that more primary care providers will be able to vaccinate. However, The full implementation of the third-party administrator has been somewhat delayed and will now happen by the end of the month on March 31st. We are still working closely with our healthcare partners and more so in the next few weeks to decide what this phase will look like here in Santa Barbara County. Next. With regards to vaccine distribution, we will continue to abide by state guidelines with 70% of our allocation going to healthcare providers for the 65 plus, 30% to public health community clinics for eligible sectors. Appointments will be made available on Mondays for clinics on March 9th, March 10th, and March 11th for the agricultural and food service, as well as for emergency services. Vaccination for transitional kindergarten through 12th and childcare will still be coordinated with the Office of Education. Vaccination for higher education will be coordinated with our school liaison. We are still in planning phases and will be creating additional clinics for sectors with our 3 hospitals and Sansum Clinic. Next. I'd like to end by encouraging our community to be vigilant with their actions. Please get tested. Please continue to wear your mask, maintain your social distance, and limit gathering. I think the point I'd really like to highlight today is that while vaccines have arrived, even though in very limited numbers, and we are thrilled to have them, there are so many things that our community members can do right now to help stop this pandemic. So again, really underscoring the need to get tested to help us detect where the virus is spreading and stop the virus in its track by getting tested. Thank you. And with that, I'd like to pass it to Dr. Ansorg, our County Health Officer.
Thank you, Director Dorianoso. Good afternoon, everyone. I would like to address the new vaccine that will be available for use in Santa Barbara as soon as next week. The medical community and public health is very thrilled to have an additional highly effective vaccine that's available now to help achieve the goal of getting everyone vaccinated as soon as possible. We are anticipating 20 million doses by the end of March and 100 million doses by the end of June for the United States. Santa Barbara County is slated to receive 3,200 doses of this new vaccine in addition to the other vaccines by next week, early next week, as a first shipment. Some people are wondering if this new vaccine from Johnson & Johnson is as good as the Pfizer or the Moderna vaccines. Numbers presented in the press when reporting on the trial data of each vaccine have to be put into context in order to make an accurate assessment of the quality of the different vaccines. The reported numbers have to be interpreted skillfully, otherwise it is very likely to come to incorrect conclusions. During the latest trial for the Johnson & Johnson vaccine, 85% of vaccine recipients achieved protection from severe COVID 28 days after having received this shot. The protection against dying from COVID was 100%. In order for the FDA to approve a vaccine, the studies have to show that the vaccine is safe and that it shows efficacy in preventing the disease and death from the disease compared to people who did not get the shot during the trial. After a vaccine has been used for a while in real life, additional new information and statistics will accumulate quickly and will provide the data to determine the real-world effectiveness of any given vaccine. That is normal. After an in-depth evaluation of the Johnson & Johnson trial data, It is very clear that this new vaccine has several advantages over the Pfizer and Moderna products while performing comparably. For instance, it requires only one shot. It is highly efficacious after already 28 days. It causes less frequent and generally milder reactions. In particular, anaphylaxis or severe allergic reactions have not been seen. It is easier to transport and handle, and therefore can be used in mobile clinics, for instance, and facilities that do not have freezer capacity. It compares very well in efficacy to the other vaccines. It does work against worrisome variants. I am predicting that this vaccine will become a preferred option for many people very quickly for all of those reasons. Having said that, the best vaccine always will be the one that is available at any given time. We encourage everyone to get vaccinated as soon as it becomes available to them, regardless of which product you're gonna get. Now, regarding youth sports, we are again thrilled that our youth sports teams have been able to start training again as early as this Wednesday. While we appreciate that parents and friends of the young athletes are eager to take part in the team's training progress and competitions, we are appealing to them to please be considerate and patient at this time. Please do understand that we have to put the safety of our athletes, their coaches, and the whole community first. We are still experiencing widespread transmission of the virus, which can only be mitigated by avoidance of crowds, of gatherings, and by wearing masks and abstaining from high-risk behaviors. That is the reason why at this point spectators cannot yet be allowed, and why we have to limit observers to immediate household members only for now. Our teams currently can only train and play in the high contact sports safely as long as stringent infection control and frequent testing protocols are being followed. That is a statewide mandate. We are asking for your understanding and cooperation in this matter. Once we achieve lower case rates due to less community spread, all of our lives will be able to resemble more of what we would like it to be. In the meantime, please continue to wear your masks, avoid crowds, keep socially distanced from people outside of your immediate households, and get the vaccine as soon as it becomes available for you. Thank you for your cooperation.
Thank you, Dr. Ansorg and Dr. Dornoso. Before we go to our first media, Blake Devine with KEYT will be up first, but I just wanted a reminder to media who may have joined us a little late. We have a hard stop at 5 p.m. so that our health experts can get on a state conference call. And with that, Blake, you have the mic.
All right, thank you so much. So I just want to clarify how close our numbers are to reaching that red tier. If we could just get a breakdown real quickly of our numbers right now and what we need to be at to reach the red tier.
Well, it's very promising. Our numbers have been going down continuously from over the last couple of weeks. However, the decline has been somewhat slowed. So we are still a little bit away. We are in the 11.3 range, I believe, or just above 10. And we need to be below 7. So time will show. The magic date when we always determine what our number is for that particular week is Monday evening. And on Tuesday, this will be made public. But be advised, it needs to be 7 or below to actually be eligible for the next less restrictive tier.
And then I just want to clarify, you said 3,200 doses of the Johnson & Johnson vaccine next week. The press release that was sent out said 3,800. Wanted to clarify which number was correct.
That is correct. It's 3,800.
Okay, my mistake.
Okay, thank you. And then with the rules for spectators at high school sports games, explain how there's allowed to be 4 individuals from the athlete's household, but there's no spectators. Just explain the discrepancy between the two and how that'll work.
I don't understand your question with regard to discrepancy. There's no discrepancy. We want as few people around the field as possible to avoid crowds, to make it possible for everybody who is at the sidelines to social distance. Spectators are simply not welcome at this point. That sounds cruel, but that's just the fact of the matter. We are allowing very high contact sports, which has a very high risk for spread of the virus. And therefore, we have to be very, very diligent in protecting our athletes and make sure that they are safe to continue their season. So please, please understand, we only can allow immediate household members at the sidelines at this point for practice and competition.
Okay, and then how many immediate family members are allowed? Is it
As few as possible, please. This is meant for direct age-appropriate supervision. I understand that a parent who is concerned that their child playing football might get injured or something has to be there. That is completely understandable, and we totally want to accommodate that. But it cannot be like the friends and neighbors at this point. This may change very quickly, but at this stage, we cannot throw the baby out with the bathwater. We have to be careful. We cannot just get ahead of ourselves. We are still in the wide spread of the virus in the community. So please be patient. It won't take long.
And then last question for me. Obviously, last month in February, we experienced the most deaths per day compared to any other time during the pandemic. Could you guys just describe how this loss may be affecting loved ones, but also the frontline healthcare workers that have just seen so many lives lost, especially last month?
It has taken such a toll on our healthcare workers. You have no idea. They are emotionally drained by experiencing these solitary deaths in the hospital. And it is heartbreaking to hear their stories. Our deaths have been still high for mainly one reason, and that is that deaths lag behind the active cases in the hospital because they're fighting for their lives in the ICU, and at some point there's just no way for them being saved, and it always lags behind in time the hospitalization data. So it's been a very, very difficult 2 months for our healthcare workers. I can tell you that.
Thank you.
Thank you, Blake. Next up, we're going to Tom Bolton with Newshawk, who will be followed by Laura Place at Santa Maria Times. Go ahead, Tom.
Hi, good afternoon. Thank you. I sent you all an email earlier this week showing a comparison of the criteria for the tiers with Santa Barbara County, as well as a number of other Southern California and Central California counties. And what it shows is that Santa Barbara County is at the wrong end of the scale on almost every metric. And I'm wondering if you can tell us what the explanation for that is and what's being done to address that.
I think what's important is to look at the numbers you sent, Tom, from a weekly perspective and not necessarily a snapshot, a daily snapshot. All the counties that you sent to us, all of those counties are Southern California counties, and they're all unfortunately in the purple tier with us, except for San Luis Obispo. So that's probably my main point. The second point is that when we look at the cases and we look at the decrease in the rates, we are seeing a very, very remarkable decrease in our case rate and testing positivity. That's why Dr. Ansorg is anticipating and just responded to Blake that we do anticipate moving to the red tier sooner than later. But it really hinges on our community's collective behavior. So, what we have been doing about it, I wish we could move quicker. And in that way, we, on every press conference, every opportunity that we have, we've been asking community members to wear their mask, to limit their gatherings, and to do the social distance, and to minimize that crowd gathering, that participation in high risk behaviors. We can only do so much, and we amazingly applaud all the community members who have been adhering to public health guidance. That's why we are seeing a downward trend. But unfortunately, there are community members who are not. And so to that, I would like to publicly say, we need to work together as a community and collectively adhere to the masking guidance, to the social distance guidance, and to the limit on gathering guidance, so that we can see that decline continuing and at a faster pace, like all of our neighbors.
I'm sorry. So are you saying that part of the reason, at least, is that people locally are not as diligent about those things as they are in other areas?
I would say that is a key factor. And
Okay.
all of us have been working really hard. The healthcare system, our community partners, we are all messaging the same public health guidance. And so now it's really it comes down to the wire, right? That community members all need to abide by them. And again, I want to pause and also celebrate all those community members who've sacrificed so much to get us where we're at. But we just need to work a little bit harder together.
Thank you. I wanted to go back to the question of people who are under 65 with some of the health conditions, which seem to be in the next group that will be coming up. And it sounded like you were saying that was going to be delayed. Is that, am I correct in understanding that?
No, so the guidance says that this will happen on the 15th, but the implementation of it is a little bit unclear. So the state had anticipated that the vaccinations would take place in the healthcare system, not necessarily by public health in our community public health sites. But with the delay in the third party administrator, the implementation of that March 15th date for community members with comorbidities, it's a little bit more problematic. And we are just needing to work through the logistics with our community healthcare providers and see what we can do together.
So are you still determining how that will work and who will make the determinations as to who's eligible?
That is correct. The determination lies with the primary care physicians and the healthcare system.
Okay. One last question. I know they have others that want to ask. I had a question from a reader today who got a first dose at I don't know if it was the Wake Center or at Hancock College, and they're wondering about how they get their second appointment. They were given some information about getting an email, didn't happen. What do they do in that situation to get the information they need?
They can call our 211 call center, and we are more than happy to assist. But also know that we have our team is working, combing through the first doses, and we'll be reaching out to the community members who are in need of the second dose.
Okay. Thank you very much.
Thank you, Tom. Next up, we're going to Laura Place with Santa Maria Times. Go ahead, Laura.
Thank you. My first question is about the Johnson & Johnson vaccines. So do you have a day at this point that you're expecting them to arrive next week? And I was also wondering if those vaccines specifically from Johnson & Johnson will be going to specific providers like public health versus, you know, hospitals and clinics, or if they'll kind of be widespread, and if they'll be designated towards certain sectors.
We expect it to arrive on Monday, latest Tuesday, and most of it will go to our public health points of distribution, affectionately known as pods. A big bunch will go to Sansom Clinic for their patients, and we don't have any specific populations or anything that will get them. Anybody can get it. It's for some probably going to be a preferred vaccine because all they need is one shot. That makes it very convenient and compelling.
Okay, and going off of that, is there going to be like an opportunity for people to have a preference, like, or is it kind of like if they are offered an appointment with, say, a Johnson and Johnson vaccine and they don't want it, they just have to suck it up and wait for another one? Is that kind of how it's going to go?
We will be very transparent which vaccine will be available at a specific clinic, and if somebody is not wanting that particular product, they can reschedule.
Okay, thanks very much.
Thank you, Laura. That's great. We have time for our last media representative, Atmika Iyer with Daily Nexus.
Hi, this is just a logistical question from a vaccine standpoint. Because a lot of students who live in Ivy live here for college, but also have a home in another county, should they wait to be vaccinated through the university or their like home county?
My suggestion would be wherever you can get it first, get it there. It doesn't really matter.
That's all. Thank you so much.
Thank you. And that actually was our last question. So we were finishing at a great time to get our experts back on their conference call. That does conclude today's press conference. Next Tuesday, the Board of Supervisors agenda includes an update on the pandemic beginning shortly after 9 a.m. You can watch the board meetings live on cable TV, channel 20, youtube.com at CSB TV 20, as well as via the county website at countyofsb.org. The next press conference is next Friday, March 12th at 4:30 p.m. As a reminder, we've started a new partnership with KYT KCOY. Each Thursday in the 11 a.m. news broadcast, News Channel's Joe Batista is interviewing our county public health experts to bring the community live updates and information. As well, you can go to the county's public health data dashboard, our vaccine information, FAQs, videos, and more at publichealthsbc.org, listed there on the bottom of your screen. You can also call 211, select option 4 for information or to be connected to the county's call center. Thank you again for your ongoing patience and diligence to slow the spread of this virus in our community. And we just we're getting to the end. And if everyone can just hang in there with us and stay diligent, and we're going to get through this together as a community. And with that, we wish everyone a safe and healthy weekend, and we'll see you again next week. Thanks so much and have a good night.